Hi, everybody. Welcome. Thank you so much for attending. I'm really looking forward to talking to all of you after this presentation about Medicare Open Enrollment. I want to let you know that this presentation is being recorded and that you can watch it later on the YouTube channel associated with this organization. So let's get ready to get right into it. This is making the most of fall open enrollment. My organization is the Medicare Rights Center. We're a national nonprofit consumer service organization that works to ensure access to affordable health care for older adults and those with disabilities through counseling and advocacy, educational programs, and public policy initiatives. The learning objectives of today are to discuss the differences between original Medicare and Medicare Advantage, to understand how to make changes during fall open enrollment, and know the Medicare marketing rules, as well as identifying programs that can help pay for Medicare costs. Fall open enrollment. This is the annual period when you can make changes to your Medicare coverage. It begins October 15th and it ends December 7th. Your new coverage, whatever you choose during that window of time, will take effect January 1st, 2025. Fall open enrollment, you can make these changes. You can join a new plan. You can join a different Medicare Advantage plan or join a different standalone Part D drug plan. You can also switch your coverage. You can switch from original Medicare to a Medicare Advantage plan or switch from a Medicare Advantage plan to original Medicare. Medicare benefits. Here are some terms that are good to know. And if you don't know them already, it's always good to make sure that you fully understand what they are. Premium. This is the monthly amount a person pays to have Medicare or a private health plan or a Part D plan. It's like a subscription. You pay it every month, no matter whether you use the insurance or not. Deductible. That's the amount a person must pay for healthcare services before the insurance begins to pay. So you have to pay up to $500 out of pocket before the insurance starts covering it. Coinsurance. This is a portion of cost of care of a person pays after the health insurance pays. So for instance, you pay 20% of the cost of a doctor's office after your insurance pays 80%. And that's how original Medicare covers outpatient costs. Copayment. That's a set amount a person pays for each medical service received. So for example, you pay $20 for a doctor's visit, and that's how generally Medicare Advantage plans work. You pay a set fee every time you get a service. Parts of Medicare. Medicare benefits are administered in 3 parts. Part A, that's hospital or inpatient benefits. Part B, that's doctor or outpatient benefits. And Part D is prescription drug benefits. Now, Part A, when we're talking about Part A, we're not saying you got taken to the hospital and maybe even had a surgery and then you went home. That isn't necessarily Part A. Part A is only if you're admitted as an inpatient. So it all depends on that status of being an inpatient. And Part B has a pretty broad interpretation, therefore. So if you go in for a colonoscopy, you may be at a hospital, you may be getting all kinds of medications, and you may be staying there for a very long time, even potentially overnight. But if you're not admitted as an inpatient, Part B is covering that service. And Part D, when we talk about prescription drugs, we're not talking about prescription drugs you get at the hospital if you're an inpatient. That would be covered under Part A. Part D is strictly what you get at the pharmacy. So CVS, Walgreens, Rite Aid, any of those places where you pick up prescriptions, that is Part D. And it's really important to know that outlet where you receive services through Part D. And we'll talk about that a little bit more later. 2 ways to receive Medicare benefits. Original Medicare. This is the Medicare benefits you get through the traditional program administered by the federal government. It's sometimes called fee-for-service Medicare. And then Medicare Advantage. Now, this is Medicare benefits through a private health plan that contracts with the federal government. It's also called Part C. It's not a separate benefit. Anyone with Medicare Advantage still has Medicare, but it is the private health insurance company that determines how that benefit is administered. Well, raise your hand if you have a Medicare Advantage plan. That's Medicare benefits administered through a private health insurance company. So you would know because you would have a card that would show your doctor that would say Aetna at the top, or United, or Humana, and it would maybe even say Advantage on the card, but it would be one card you would use for all of your health services. Okay. Original Medicare and Medicare Advantage. This is a sort of contrasting the two programs. Under Original Medicare, you can receive covered services from any provider in the U.S. who accepts Medicare. So you could take your red, white, and blue card and go to a doctor in Arkansas and see a doctor, and they would take Medicare as long as they agreed to take Medicare. But if you have a Medicare Advantage plan, you have to see in-network providers in your service area to receive covered care or care at the lowest cost. Under Original Medicare, there are no referrals or for a specialist, so you can just pick which doctor you want to go to. Under Medicare Advantage, you may need a referral for a specialist. Under Original Medicare, it does not include hearing, vision, or dental coverage. That is excluded from Medicare. Under Medicare Advantage, they may offer some coverage of those things. Under Original Medicare, there's no limit on out-of-pocket costs. You can purchase a medigap policy to cover Medicare cost sharing, so deductibles, copays, etc. Under Medicare Advantage, all Medicare Advantage plans must have a maximum out-of-pocket limit. Costs in 2024. Original Medicare, the Part A premium, if you owe one, and that would only be if you lack the work history, the work credits to get premium-free Part A. Part B, the premium is $174.70 a month. The annual costs of Original Medicare for the Part A deductible is $1,632 for each benefit period. So if you get admitted into the hospital, you're going to have to pay that deductible right away. And for Part B, the deductible is $240. So you have to pay out $240 out of pocket before Part B starts covering your outpatient coverage. And the ongoing charges, there's a daily coinsurance for some inpatient care. So after you've reached a certain amount of days in hospital, they'll charge you per day. And for outpatient, they charge you 20% coinsurance for outpatient care. So Original Medicare covers 80%, and then you're responsible for 20%. Now under Medicare Advantage, can we go back? Under Medicare Advantage, you still have to pay the Original Medicare premium. So you'll still have to pay the Part A premium if you owe it. You'll still have to pay the Part B premium if you owe it. I mean, yes. But the plan may charge additional monthly premiums on top, depending. There are deductibles on certain plans, and certain plans don't. There are thousands of different Medicare Advantage plans, all with different terms. The maximum out-of-pocket limit for Medicare Advantage is $8,850 at most. And copayments are usually charged for services, and they vary by plan. So one Medicare Advantage might be $20 per office visit. One might be $30. One might be $50. One might say specialists are $40. One might say specialists are $75. It all just depends on the plan. Medigap policies. Medigap policies are supplemental plans that pay part or all of the remaining costs after original Medicare pays first. For example, a medigap policy can pay for your 20% Part B coinsurance. They only work with original Medicare. They're provided by private insurance companies, and there are 10 standardized plans. They're plans A, B, C, D, F, G, K, L, M, and N. And they charge a monthly premium for coverage. Depending on your state, it can be more or less. But generally, the premiums for a medigap are going to be, on average, higher than any premium you would pay for a Medicare Advantage plan. Medicare Advantage plans and supplemental benefits. Now, these plans can offer benefits that aren't directly considered medical treatment, called supplemental benefits. They include transportation, in-home support, adult day care services, and also they can include excluded services like we talked about, such as dental, vision, and hearing. And they will do so at their own discretion. So whatever amount they cover will be extra. It will be extra from what Medicare covers. So those benefits might be just a little bit, might just be giving you a cleaning twice a year or something like that. Or some might offer like a dollar cap amount of coverage that they offer of dental, for instance. It's really important that you read the plan materials carefully so that you can find out exactly what the plan covers. Medicare drug coverage, Part D. Medicare Part D is the outpatient prescription drug benefit for anyone with Medicare. You're eligible for Part D if you have Parts A or Part B. It's only available from private insurance companies. Everyone is responsible for a monthly premium. There are two ways to get Part D coverage. Original Medicare, you purchase a standalone policy, and a private plan offers only drug coverage to you. You enroll through Medicare by calling 1-800-MEDICARE or enrolling by going on medicare.gov. You can select the plan of your choice. After entering your zip code, it shows what's available in your area, and you enroll. Now, if you have Medicare Advantage, Part D is generally included. It's usually only a Medicare Advantage plans, very rare, sometimes Medicare Advantage plans like for people with VA benefits will exclude Part D coverage. But for the most part, most Medicare Advantage plans include Part D. And it's the same card you use for all of your Medicare benefits. Raise your hand if you have creditable drug coverage. Now, this is most job-based or retiree plans allow you to delay enrollment in Part D because you have something equivalent to it. Veterans benefits, as we talked about before, that's equivalent to Part D. If you have veterans drug coverage, you don't have to enroll in Part D. And federal employee health benefits, another example. Part D coverage and costs. Each Medicare drug plan has its own formulary or list of covered drugs. Each plan charges different premiums, deductibles, and copays. The average basic Part D premium is about $34 in 2024. Part D plans use tiers to categorize prescription drugs, and you pay less for drugs in lower tiers. So if you are taking like a highly new and rare type of medication that's very, very expensive to make, that could be tier 4, and that'll be a very expensive drug. But if you take a more common drug that you can pick up in a generic form pretty much anywhere, that's going to be a much lower tier and have a much lower price. Drug cost changes in 2025. Now, starting in 2025, annual out-of-pocket Part D costs will be capped at $2,000. This is courtesy of the Inflation Reduction Act. This includes deductibles, copays, and coinsurance. So if you had a $500 deductible on your Part D plan, and you had to pay that $500, and then it started covering the drugs after that, if you hit $2,000 out of pocket, including that $500 that you put out for the deductible, you don't pay any more for the rest of the year. So this is a huge benefit, a huge savings for people who have high drug costs. You can also elect to have the costs spread out over the year. So if you know that you're going to hit $2,000 because of the cost of your drugs, you can arrange with your Part D plan to have a payment plan for, $2,000 divided by 12. So every month you have a limited payment each month until you hit the full amount. And that way you don't have to kick out $2,000 in the first 2 months if you know that your drug costs are incredibly high. This is what we're talking about, the Medicare Prescription Payment Plan. All Part Ds must now offer this new payment option in 2025. You can decide if you want to join. If your Part D is aware that you take drugs that are very expensive, they'll probably reach out to you proactively and say, hey, you would be a good candidate for this plan. Do you want to do it? And you can set up a payment plan with your Part D. You'll pay a monthly bill, and you will not be charged at the pharmacy. You'll pay all directly to the Part D. So now we're moving on to Fall Open Enrollment. Fall Open Enrollment is where you can review your current Medicare health and drug coverage. Your plan coverage and costs change every year. It's very important that you stay on top of it. If you're dissatisfied with the coverage for next year, you can make changes during this period. You can enroll in a different Medicare Part D or Medicare Advantage plan, or you can switch between original Medicare and Medicare Advantage. Now you'll see that there's going to be a lot of increases in Part D this year because of this reform to the pricing. So you might, if you haven't been paying attention, you should really check in and see, how much is my Part D going to cost next year? And if it's going up dramatically, you should go on your Medicare.gov plan finder tool and search the different plans and find one that might be less expensive. If you have original Medicare, read the 2025 Medicare and You Handbook. All the Medicare households should receive this handbook in late September. You can also download it or call 1-800-MEDICARE to request a copy being sent to you. You review the handbook for any changes to original Medicare's coverage of the upcoming year. If you have Medicare Advantage or a Part D plan, read the annual notice of change and the evidence of coverage. Now, the evidence of coverage is this very long document that all plans have to have. It is usually it's over 100 pages long. It's incredibly detailed language, and sometimes it can be kind of hard to read. But what I recommend is, if you know you're searching for one particular type of health service, to hit Control F and then type in the issue that you want to search for, the health service that you're interested in and investigating, and it'll show you every instance that phrase is used in the evidence of coverage, and you can find, it'll say exactly how much it covers and for what. And your plan has to follow that. That's its guidebook. Those are the rule books to the plan, and the plan must follow that document. So it's a very good idea to become familiar with that and to know what it is, and to search it for relevant information in case there's any miscommunication or misinformation coming from your plan. If you have a Medicare Advantage plan or a Part D plan, pay attention to any plan changes, benefits and coverage rules, costs, formulary, that's the list of the drugs that they cover it. Check if your plan has made any changes to how you access your drugs, like requiring prior authorization. So when you take expensive medications, your plan doesn't necessarily want to cover it because it's going to be very, it's not cost effective for them. So they might create prior authorization and say, we won't prescribe this drug unless we decide that you should have it. And then you have to get the doctor involved, and there has to be some kind of appeal process to try to get them to reverse that decision. Make sure that doctors or pharmacies are still in your plan's network, and check with your providers directly or use the plan's provider directory online. This is just sort of the thing, like when you go to see your doctors and your providers, you want to make sure that they're not saying, actually, we don't take this insurance anymore. That's a really terrible thing to find out when you're already beyond the point of being able to change your plan. So being proactive about it and making sure at this time of year is super important. Compare plan options. Use Medicare's Plan Finder tool to help comparing Medicare Advantage or Part D plans. This is what I was talking about before. If you go to medicare.gov and you go up in the corner where it says find a plan, and then you select what type of plan you want to find, whether it's Medicare Advantage or standalone Part D, it then takes you through a series of very simple prompts. Your zip code, for instance, it tells you to list your drugs. Once you've done all that, it's going to very clearly show you what's available and rank in order what is the most cost effective. And also it shows you month by month how much you should pay out of pocket for the entire year, and which drugs are costing what. So it's a very, very valuable program that's actually quite easy to use. I recommend it highly. You can also call 1-800-Medicare if you don't use a computer or you don't feel comfortable doing any of that. You can call 1-800-Medicare and get the exact same information. You'll just be talking to somebody over the phone and talking them through it. Now, they say that calling the plan is the last thing we recommend to do. Not that it's the worst thing to do, but it's better to talk to Medicare first than reaching directly out to the plan. You can reach out to the plan just to confirm, is it true that this has changed here, or that you are enacting this, or that this drug is no longer on the formulary. But I would start first talking to Medicare. So you can enroll in new coverage. It's usually best to call 1-800-Medicare when making changes to your health or drug coverage. And again, alternatively, call a plan directly. So when you're making enrollment, it's a really good idea to go straight through Medicare, because then enrollment errors are much less likely to occur, and whatever you do has to be recorded in their system. And so there's actually some accountability when you make these decisions and make these changes. But if you call a representative of a private health insurance, you may never be able to figure out what got said to who or who made what decision. It's a much better idea for you to make enrollment decisions and enrollment changes directly with Medicare. Fall Open Enrollment Recap. Begins October 15th, ends December 7th. Your new coverage will take effect January 1st, 2025. The changes you can make: you can join a new plan, you can join a different Medicare Advantage plan, you can join a different standalone Part D drug plan, or you can switch. You can switch from original to Medicare Advantage, or from Medicare Advantage to original Medicare. Medicare marketing rules. Medicare has rules about how insurance companies, plan representatives, and brokers can communicate with you during fall open enrollment. Plans and their representatives cannot call or email you if you're not enrolled in the company's plan. Visit your home if you did not make an appointment. Sell you a plan or set up a marketing appointment with you while at an educational event. Or use the Medicare name logo or imply that they represent Medicare. Or approach you in a public space like a mall or a parking lot. Now, I have heard of, and I know of Medicare beneficiaries who've passed somebody with a folding table in a grocery store or on the sidewalk, and they're offering OTC cards. They're offering free Outback Steakhouse card or whatever. Like, they offer some sort of incentive. All you have to do is sign up for this, and they don't really push too hard on what it is they're signing up for. They kind of let you lead the dance, and then you're signing something to get your card, and then you've just disenrolled from your plan, and now you're in a really tough spot. So it's really important to know they're not allowed to do those things. But some salesmen and some people, they're making a commission. They have a vested interest in having you enroll with them. So you should definitely be on guard when salespeople are calling you at your home and asking you for information or pressuring you or giving you some kind of sales pitch about Medicare. Very much be on your guard, and in some cases you should just end the conversation. Look out for red flags. In general, you should not feel pressured or rushed to enroll in a plan. No one should make you feel that you could lose your Medicare benefits if you didn't enroll in the plan. Be wary of cold calls from people asking for personal information. No one should ask for your Medicare or Social Security numbers just to provide you with plan information. So take your time making enrollment decisions in the ways we discussed. Use your Medicare Plan Finder tool. Call 1-800-MEDICARE to review different plans. Look at the evidence of coverage. Get to know exactly what your plan is and what you want it to do differently, and then go about consciously choosing a better option. Reporting marketing violations. If you think a plan or agent has violated Medicare's marketing rules, keep any documented proof. For example, the agent's business card, marketing materials, phone call records. Like if you were that person who took that gift card and signed that paper, what was that person's name? What was the date? Where were they set up? That sort of basic information can be incredibly helpful when you're calling to try to undo what was done. You can report marketing violations to the Senior Medicare Patrol. They're like the SHIP program. There's one in every state, and this is their 800 number. It's 1-877-808-2468. Medicare cost assistance programs. Here are some programs that can help pay Medicare costs, and we'll talk about them each individually. There's the Medicare Savings Program, or MSP. Extra Help, which is also called the Low Income Subsidy, or LIS. And this is in New York State, the Elderly Pharmaceutical Insurance Coverage Program, EPIC. But every state in the U.S. has a state pharmaceutical assistance program. So whatever state you are in, you can look up and see what is my state pharmaceutical assistance program, or SPAP. So MSP basics. MSPs pay for the Part B premium, which is $174.70 in 2024. There are 2 MSPs in New York, but there are 3 nationwide, so it depends on your state. These are the different types of MSPs. There's qualifying individual, QI. Not listed here is specified low income Medicare beneficiary, or SLMB, SLMB, and qualified Medicare beneficiary, QMB. And its eligibility is based on your monthly income, and in other states, it's based on income and assets. So the MSP eligibility in 2024 for QI, a single household can make $1,715 a month. That's gross. So that also includes adding back in the $174 that gets deducted from Social Security benefits. For a married couple, $2,320 a month, gross combined income. And you see for SLMB, $1,526, $2,064 for couples. For QMB, $1,275, $1,724 for couples. And here we have the asset limits. This is a national asset limit. State by state, they're more generous. So you might live in a state that has no asset limit. You might live in a state with a more generous income limit for all of these different programs. The best way to check is to call your local SHIP, State Health Insurance Assistance Program, that can tell you what the income levels for the MSP are in your state, and you can determine what that is. How do I get an MSP? You contact your State Health Insurance Assistance Program for help applying. The California SHIP is 1-800-434-0222. But if you want to look up your individual state, if you don't live in the state of California, you can look that up online. Or if you call this SHIP number and say you want to be connected to a different state's SHIP, they should be able to do that as well. Okay. So Extra Help. Extra Help is a federal program that helps pay Medicare Part D premiums, deductibles, and copays. It only works with Part D plans. You can get Extra Help automatically if you have a Medicare savings program. So that program we were just discussing that gives you back $174 on your Social Security every month will also automatically get you this benefit. You also get it automatically if you have Medicaid or supplemental security income. Full Extra Help eligibility in 2024. The income limits, and this is a federal program, so this is nationwide, is $1,903 a month gross. Asset limits, $17,220. Those are for singles, and for couples, $2,575 a month. Asset limit, $34,360. If you qualify under these limits, you could call Social Security immediately and have them sign you up for this benefit. You can also fill out the application online. And if you have Extra Help, it is basically going to discount your prescription drugs to such an extent that you will be very much protected from any prescription drug costs. It's an incredible and robust benefit. It also pays your Part D premium at the benchmark level. So if you have a basic Part D plan, you won't even pay a premium for it. And if you were late signing up for Part D, it'll eliminate your late enrollment penalty. If you don't have Part D, it will automatically enroll you in Part D. So it's an incredible benefit. How do I get Extra Help? Apply through the Social Security Administration. That's the online address for obtaining that. Or you can call their 800 number, 800-772-1213. You can also go directly to a Social Security office if that's what you prefer. You can also contact the Medicare Rights Center. Our number is 1-800-333-4114 for help applying. Resources. For questions, call the Medicare Rights Center at 1-800-333-4114. Our helpline is open from Monday to Friday, 9 to 3. You can call and speak one-on-one with a very knowledgeable counselor who can give you very accurate Medicare information to help ground you in whatever the issue is that you're struggling with. It's an excellent resource. We are not affiliated. We're a national nonprofit. We're not affiliated with any private health insurance companies. We're not going to sell you anything. We are going to take you the information you give us and store it in our secure, confidential database so that should you call again, we have the information that you provided to us before to continue on, and you don't have to frustratingly reinvent the wheel every time you call. Medicare Interactive is part of our website. So if you look on our website, it is an incredible online resource developed by our education department with flyers that explain Medicare issues in very simple terms. So you can just search it and find all kinds of answers to all kinds of questions. And thank you so much. I really appreciate you taking the time and for allowing me to speak to you today. And I'm more than happy to take questions that have come up during this presentation.
Thank you so much, Max. We have received many questions from the audience. And the first question we have to highlight is someone has asked, how about Medicare coverage for in home needs and safety, such as medical beds, side rails, walk in tubs, and handrails, etc.?
Okay, it's a great question. These things are related to Part B. They're durable medical equipment. And walk-in tubs, unfortunately, are not covered by Medicare. But some of the other things, very well, maybe. But I think the best course is to contact 1-800-Medicare if you have original Medicare. If you have a Medicare Advantage plan, to search their evidence of coverage, see how they cover durable medical equipment, and to see how they will cover it, and under what you have to use a distributor that they work with. They pick that, they determine that. So you just need to really cooperate with your plan and explain what your needs are, and they will let you know what coverage is available.
Thank you. The next question is somewhat similar. The person has said that they are looking for help for their husband with advanced Parkinson's disease, and they're looking for help specifically in paying for home care for him. They've asked, can we get help through Medicare?
It's a great question. So Medicare does not cover long-term care. They cover skilled care. So I'll give you an example. If you fall and you have to go to the hospital, you're in the hospital now. It's covered under Part A. You stay for more than 3 days, and then the doctor can choose to discharge you to a skilled nursing facility. That's still covered under Part A until you stay there for 20 days. That's fully covered by Part A. After that, there's a coinsurance associated with that. You are recovering from that fall. And as Medicare starts to determine, you can walk on your own. You have a little bit, you are starting to get control of this. You no longer need skilled care to be treated, and you no longer need occupational therapy or physical therapy. Then they either send you home, or they might prescribe you with home care for a limited time. But the whole time that they give you that in-house home care, they're pulling back the services as you're getting a little bit better and showing improvement, because Medicare inherently does not want to cover long-term care. And by long-term care, I mean activities of daily living and such like that. Bathing, toileting, turning you over in bed, help with someone cleaning your apartment for you, or cooking, or helping with that sort of thing. That is excluded from Medicare. So as soon as it starts to look like that, then that's when Medicare pulls the plug on that care. So people who want long-term care apply through Medicaid. So oftentimes people go into some sort of arrangement where either they go into a spend down program so that they qualify for Medicaid if they don't anyway, or if they need Medicaid and they have excess of asset or income, sometimes they may consult an elder law attorney to engage in something called a pooled trust, so that they can put their excess income into a trust so that they can qualify for Medicaid and get long-term care. But Medicare inherently does not cover long-term care for activities of daily living.
Great, thank you. That was very informative. The next person has asked, how can a person find out about what drugs are covered under each plan? I take a very expensive medication, she says.
Okay, so there are two ways. One is to go to Medicare.gov. You search, you go to find a plan, and you search either Part D or Medicare Advantage. You enter in all the drugs, including your very expensive drugs, and then once it runs the plan finder, it's going to tell you which plan covers the best, is the most cost efficient for the entire year, given all the different drugs you have inputted.
Thank you. Another question. The audience member shared that she's 63, turning 64 in December, and she currently has Anthem Blue Cross through her husband's employer. She wants to know when she should begin the Medicare process.
Okay, great question. So as long as you or your spouse is covered by a group health plan, and a group health plan is like a private plan or a plan begot through active employment. And if your employer has more than 20 employees, then you can delay enrollment in Part B for as long as you're on that plan. So if your husband stays working and doesn't retire for the next 10 years, you can delay Part B for those 10 years. I'm assuming that his employer employs more than 20 employees. The reason I say that is because if the employer has less than 20 employees, then Medicare is primary over it. So you would need to enroll in Medicare as soon as you turn 65 or you become Medicare eligible.
Thank you.
Oh, sorry. One last thing I say. When you are ready to take Medicare, and when you know your husband is retiring, you should anticipate it at least a month before, and then you have to fill out the L564 form, the Social Security, which your employer helps you fill out, which attests that you've been on this plan this entire time since you turned 65. And also you fill out the CMS 40B form, which just says, I want to sign up for Part B and I want it to be effective this month. And you go to your Social Security office that month before retirement and you file that paperwork and you set up Part B to start the first of the month following retirement. That way there's no gap in coverage.
Thank you. That is very helpful. And Clifford has just asked, I recently moved to a new state. I believe I can keep my current medigap plan. Is there a reason to change?
That's an excellent question. So your medigap policy is set up to be able to cover anywhere. I think as long as the policy doesn't pressure you when it sees that you have a new mailing address when they're sending statements to you in another state and says that you have to enroll in a new state, I don't see any reason to. I'll give you the example of my mother. She got Medicare when she was in Massachusetts, and she got a medigap in Massachusetts. Now she lives in Maine, but she still pays the premiums for a medigap in Massachusetts, and she goes to doctors in Massachusetts and Maine. So I don't see why you would need to do that. If you did do that, however, there's going to be some paperwork and some dancing around that can happen, because every state has different laws governing medigap enrollment, and every state has different enrollment periods where you can make changes, and you just want to be absolutely sure that you are able to make changes or switch companies or switch medigaps before you ever think of disenrolling, because you can be locked out of your medigap if you drop it, and you may never get it back. Because in some states, medigap enrollment is tethered to pre-existing conditions. So you can enroll in medigap in the first 6 months after you get Part B, and no one can look at your pre-existing conditions. But after you pass that 6 months, if you try to get a medigap, they will, and they can price your premiums accordingly. They can make you wait 6 months or longer while paying premiums and not covering that pre-existing condition. And they can also just not issue you a medigap at all. So you want to be very careful about pulling the plug on a medigap, because if you are not completely ironclad certain that you can get another one.
Thank you. That is such good information to keep in mind. And we have our last question from an audience member. They've asked, can we change Medicare Advantage anytime after we enroll? Because my doctor and hospital doesn't accept that insurance anymore. I want to keep seeing that doctor at that hospital.
So what you're talking about are called Part D special enrollment periods. Those are exceptions to fall open enrollment, that you can go in and out of a plan, or you can switch plans when you don't have an enrollment period. So if you use fall open enrollment, your new plan would be effective January 1st. But if you're going to try to switch your plan outside of fall open enrollment, you need to have this special enrollment period. So if you moved, if you lost Medicaid, or if you get Medicaid, if you get extra help, those benefits, those things open up special enrollment periods that allow you to make changes when you wouldn't normally be able to. If you qualify for a state pharmaceutical assistance program, then that gives you a special enrollment period. And so the best way to investigate that further for you is to call your SHIP, your State Health Insurance Assistance Program. You could call the Medicare Rights Center. You can also call 1-800-Medicare, because they're the ones who will give you that enrollment period and say, I need to change my plan. I need a special enrollment period. What can I do? And they could explain to you what that is.
Great. I think that is all the questions that we have time for today. So Maxwell, thank you so much. And I'll turn it back over to you to close out the program with any final thoughts and resources for our audience.
Thank you so much. It was a great pleasure to be able to speak to you today. And it's very important to take ownership and agency of your health care. It's a very confusing thing for a lot of people to understand Medicare and what it means and how it can work for you. So if you ever need counseling and you need that sense of feeling secure and more grounded in the information that you have, please do call the Medicare Rights Center. Our helpline number again is 1-800-333-4114. And I want to thank the American Parkinson's Disease Association for having me.